So moving on to the hind limb then, we have parts are responsible for are the thigh, which would be the part of the limb between the hip joint and the stifle or knee joint. The crus would be the part of the hind limb between the stifle and the tarsus. And the pes would be the part of the hind limb including the tarsus, metatarsus, and digits. So this would be the pes. The iliac crest is this palpable landmark of the cranial dorsal aspect of the hip bone. It's quite easy to feel right up in here. This would be your iliac crest. Go with ischiatic tuberosity and greater trochanter. This is part of the femur right here, and you can feel this gap and you get into the greater ischiatic tuberosity, greater trochanter, the proximal aspect of the femur, gap into the ischiatic tuberosity. The two ischiatic tuberosities are joined caudally here by the ischiatic arch. So that is that concavity you can feel right back in here. It's quite easy to feel. The hip joint is, again, the space to access. You can think about the space here between the greater trochanter and the ischiatic tuberosity. You put your thumb in that groove. That would be representative of the topography of the hip joint. Patella is this bony prominence here. It's considered a sesamoid bone, and that's always much more proximal than students think, but this would be the patella. The femoral condyles basically flex and extend the stifle joint and feel the distal aspect of the femur. It doesn't move that much as you flex and extend the stifle joint. Most of the movement here is occurring in the tibia, and you feel the widest point of the femur there, and those are the lateral and medial condyles. The tibial condyles then, you go just distal to the femoral condyles and keep it moving, and you can feel those the lateral and medial condyles of the tibia. They're moving back and forth with the tibia, the widest points. The tibial tuberosity is this cranial aspect here. You can feel the indentation here, and again, if it helps, flex and extend the stifle joint, and you can feel that inclination there. That is a tibial tuberosity on the cranial aspect of the tibia. Cranial border of the tibia is then distal to the tibial tuberosity and just runs down the bony cranial border of the tibia. It's quite easy to feel. The stifle, the landmark is find the patella, come distally to the patella and feel the patellar ligament and feel that space between, again, the distal aspect of the femur and the proximal tibia or tibial plateau. You can feel that gap, and that tells you where the level of the stifle joint is. Tubercalcanei, point of the heel in your eye, is basically this prominence right here in the tarsus, tubercalcanei. Muscles of the hind limb, the biceps femoris, basically extends from the sacrotuberous ligament, the ischiatic tuberosity, and it comes down to the patella. Cranial border of the tibia, tubercalcanei by means of fascia. So basically, right in here you should be able to envision is your biceps femoris with some slips coming down. That's where your biceps femoris are. Semitendinosus and membranosus are the hamstring. Semitendinosus would be more lateral. Semimembranosus would be medial. These basically go from the ischiatic tuberosity down to the semitendinosus, goes to the distal medial part of the cranial border of the tibia. The semimembranosus comes down and goes to the distal medial femur and the medial condyle of the tibia. The adductor would be a medial aspect here. So the adductor would be basically right in here, caudally. So the adductor runs from the pelvic symphysis down to the distal caudal femur. So this actually would be deep to the gracilis, but you can palpate this large adductor right in here. It's basically, again, medial caudal aspect of the thigh. The gluteal muscles basically span from the iliac crest. They run right in here down to the greater trochanter. So this is the general region where you would find the gluteal muscles, right in here. The quads are cranial, the quadriceps femoris. So they're in the cranial aspect of the thigh right here. They consist of those four muscles, vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. So you could find them and palpate them up here in the cranial aspect, deep to the tensor fascia lata, and the craniocaudal part of the sartorius. The craniotibial and long digital extensor. So basically these are muscles here in the crus and the cranial aspect. They would be essentially flexors of the hock and extensors of the interphalangeal joints. So the gastrocnemius is this muscle that extends from the distal caudal femur down to the tubercalcanei. And basically the superficial digital flexor would be from the distal caudal lateral femur to the tuber calcanea, and then back down to the plantar middle surface of the phalanges of digits 2 through 5. The deep digital flexor is going to come from the proximal caudal, tibia, and fibula, and come down across here, medially past the sussinaculum tali, so we can look on this medial aspect of sussinaculum tali, and it's going to come insert on the plantar aspect of the distal phalanges. The femoral artery, the general location of the femoral artery, is starting from the vascular lacuna. It originates from the external iliac artery. So you're going to be medial up in here, somewhat in the middle. Right here you can feel it. This is a place you can take a pulse. Femoral artery then from this region here in the proximal medial thigh is going to dive deep through the muscles, and it's going to become caudal to the stifle joint as a popliteal artery. So we can look on this limb as well. Femoral, it dives deep, it becomes caudal to the stifle joint as a popliteal artery. It then wraps around and emerges laterally between the tibia and the fibula as a craniotibial, which runs on the cranial aspect of the crus. As soon as it hits the tarsus, it becomes the dorsal pedal artery. So femoral, popliteal, craniotibial, dorsal pedal. You should know the location of those. Sciatic nerve. Sciatic nerve is going to emerge from the lumbosacral plexus and pass between the greater trochanter and ischiatic tuberosity and come down the caudal aspect of the thigh. This nerve is just deep to the biceps femoris muscle, laying on the surface of the semitendinosus membranosus. Proximal to the hip, the sciatic nerve splits into a cranial and caudal branch. The cranial branch is the fibular branch, which comes across cranial and supplies motor and sensory here to the cranial crus and the dorsal aspect of the hock and metatarsus and digits, all right? And it supplies these muscles up here, such as the craniotibial, long digital extensor, etc. The tibial nerve comes off the caudal, is a caudal branch of the sciatic. It heads between the head of the gastrocnemius. It supplies these muscles of the caudal and plantar aspect of the hind limb down here. So it also gives sensory. So sensory and motor. Motor to the gastrocnemius, long digital flexor, gastrocnemius, the superficial digital flexor, deep digital flexor, and it also gives sensory here to the caudal aspect of the crus and the plantar aspect of the heart of the hock and distal paw, distal hind paw. The femoral nerve is going to be up in here in the medial thigh, the craniomedial thigh, and obviously that's innervating the quads. So if you get in here, this would be the caudal half of the thigh. If you use the femur as kind of your landmark, just cranial up in here, that's where you're going to find the femoral nerve, innervating these quads. The saphenous nerve would be that medial branch coming off of the femoral nerve and giving you sensory here in the medial aspect of the crus and medial aspect of the thigh. So the autonomous zones for the fibular nerve here in the cranial crus, dorsal hock, dorsal hind paw, plantar hind paw, and caudal crus come from the tibial nerve, and then saphenous nerve again is the medial aspect of the thigh and crus. So the thoracic inlet is this open